Hello and welcome to our second annual Cybersecurity panel discussion. I'm Carol Fly with High Tech Answers, and this event is brought to you by our Answers Media Network and by Spoke Inc. A quick nod to our sponsor. Spoke Inc. is a leader in critical communications for healthcare, government, public safety, and other industries and organizations around the world rely on the company for workflow improvement, secure texting, and more. Please visit them online at www.spoke.com. Before we dive into our panel discussion, just a few housekeeping issues. First, this webcast is best viewed in full screen mode, so you can go ahead and initiate that on your own computers at any time and you will have a better visual. Also, a recording of this event will be emailed to you post-event. I should have that sent out certainly by the beginning of the week. We are scheduled to go about 50 minutes in length, and we will be taking some questions from our audience. After that, you can use the question tool on the GoToWebinar dashboard to ask your question. If we don't get to your question, please feel free to email me offline at carol@hightechanswers.com, and I will make sure I forward your question to the right expert and panelist. And now I'd like to introduce our moderator and panelists, the all-star group here. Our moderator is David Harlow, JD, MPH. David is a healthcare lawyer and consultant with over 25 years of public and private sector experience. His focus is on digital health law and policy, starting with HIPAA and state law healthcare data privacy and security planning and compliance for covered entities and business associates. You can read his award-winning blog, healthblog.com. Panelists joining us today by phone are Mac McMillan. He's the co-founder and CEO of Synergist Tech, Inc., an authority in information security, privacy, audit, and regulatory compliance in healthcare. He is the current chair of the HIMSS Privacy and Security Policy Task Force. He also sits on several advisory boards, including Chime, AEHS, Hit Exchange, and Health Tech Industry. Learn more at www.synergisttech.com. Joining us on webcam is Lee Barrett, the Executive Director of ENAC, a federally recognized standards development organization designed to improve transactional quality, operational efficiency, and data security in healthcare. He speaks nationally on a variety of e-health topics and is involved in a number of industry coalitions promoting the use and implementation of both administrative and clinical transactions. You can learn more at enac.org. Also joining us on webcam is Bridget Wallstrom, the Senior Product Manager for Mobile for Spoke Inc., and she is an accomplished product and project management professional with expertise in all aspects of the product lifecycle and agile process management methodologies. These include ideation, strategic product road mapping, process improvement, and product launch. You can learn more at spoke.com. And finally, last but not least, and joining us also by phone is Ileana Peters, JD LLM. She is a Senior Advisor for HIPAA Compliance and Enforcement at the HSS Office for Civil Rights. She is a national lead for OCR's enforcement of HIPAA rules and works closely with the OCR's 10 regional offices to promote compliance. You can learn more at hss.gov.ocr. David, I'm going to go on mute, and I will see you back on the Q&A, and I look forward to a great discussion.
Thank you, Carol, and welcome everyone. I'm delighted to be here today with such a distinguished panel to discuss some of today's most pressing issues about cybersecurity and about healthcare. It seems to me that almost every day we're reading news about a new significant breach, a new ransomware attack, a new settlement with the HHS Office of Civil Rights. There are also other areas of concern for those of us who are employed by or who represent healthcare providers and their business associates in the health data realm. I'm thinking of Federal Trade Commission enforcement, class action lawsuits, state attorney general actions, and also individual lawsuits based on state privacy laws. But to get started today, I'd like to step back from these endpoints and the endpoints of attacks, of exploits, of lawsuits, of enforcement actions and fines, compliance agreements, and talk about how we collectively can put our best foot forward, how we can do the right thing. Well, we certainly need to be looking over our shoulders, metaphorically speaking, but for virtually my entire career, my mantra has been the practice of preventive law. As an attorney and as an advisor, I always seek to help my clients put systems and agreements in place that might anticipate what could go wrong, that can prevent at least most of the things that are likely to go wrong. And I'm sure that our panelists today have a similar mindset as well. I came across a reference to Donald Rumsfeld's memorable phrase, unknown unknowns, earlier today. And this is a category of risk that exists in healthcare cybersecurity just as it does in military planning. But I believe, and panelists, correct me if you think I'm wrong, most of the significant risks out there are known rather than unknown unknowns. Even though these risks are known, we collectively, the healthcare community, are really not doing what we need to do at the level we need to do it in order to mitigate these risks, or else, frankly, we wouldn't be having this conversation today. For me, high on the list of unaddressed risks or insufficiently addressed risks are what I'd call collectively human factors. Staff who are taken in by social engineering or of sophisticated hackers and keep clicking on those darn links and those darn emails. There's also ransomware, other exploits, exploits enabled through the absence or the improper configuration of security tools. These human factors bleed into what I'd call institutional indifference. How many academic medical centers must be hit with multi-million-dollar penalties before all AMCs devote the attention and the resources that would be necessary to close the gaps in their cybersecurity programs? Why aren't other covered entities and business associates doing everything they need to do to maintain full compliance? So many, if not most of us, have read about the dramatic uptick in ransomware as the risk du jour these days, and we may have a collective unease about the exposure of the Internet of Things to hackers, but I bet that everyone on this webinar has heard about the audit program of the United States Department of Health and Human Services Office of Civil Rights, which enforces the HIPAA laws. And with us today is Ileana Peters, who, as Carol mentioned, is here with us to discuss issues from the government perspective. Ileana, I know I can't really put you on the spot, but I'd like to ask you to kick off the discussion today by speaking to some past, current, and future priorities of the office, and see if there are any words of wisdom you can share with us about state of compliance today and anything you can tell us about the progress of the audit program.
Sure. Thank you so much, David. Just a reminder today that the views that I express are in fact my own and do not necessarily represent those of HHS or the Office for Civil Rights. So standard disclaimer. I think it's a great question. You know, similarly to our conversation last year, the Office for Civil Rights is still really concentrating on enforcing the HIPAA privacy and security rules to provide basic security compliance and basic patients' rights to their information. So we have yet to get into the realm of what I would characterize as sophisticated best practices in the industry. I mean, what we're seeing is just, as you mentioned, the industry not doing a good job of basic security hygiene. And so that's what we're looking for. Our focus in our enforcement efforts will continue to be not only on the privacy rules side, protecting patient information, particularly sensitive information, providing patients with appropriate access to their information so they can be good stewards of that information themselves and good participants in their health care, but also to really make sure that we are creating a good baseline within the industry of security compliance with the security rule, particularly with regard to risk analysis, risk management, and implementing appropriate safeguards after those processes are undertaken by covered entities and business associates. Those have been a focus, as you mentioned, of our audit program. Our audit program, our phase 2, is well underway. So I'm sure you're all familiar with phase one, which we did a couple years ago to really try and get an idea of what a permanent audit program within our office would look like, including an evaluation study afterwards. And phase two consists primarily at this point of desk audits. As I mentioned, they are underway. We have already provided data requests to all of the entities that will be audited in this phase two. That's 166 covered entities and 43 business associates. We are actually working right now on our final reports for some of those desk audits. We do anticipate sending audit findings out. Draft findings reports were in fact sent to 40 entities last week. We expect 40 more to go out this week. So as I said, we are moving forward with those audits. Just a reminder of the process. After the review of the submitted documentation by the entity, we will share those draft findings with the entity, and the entity may respond in writing. Our final audit reports will describe how the audit was conducted, present any findings, and contain any written entity responses to our drafts. Also, just a reminder that our covered entity desk audits audited against a limited set of controls. So we're not auditing the entire privacy rule, the entire security rule, and the entire breach notification rule. For covered entities, we audited against notice of privacy practices requirements, and provision of the notice in electronic form, and the right to access. So individual right to access their own information under the privacy rule. Under the breach notification rule, we audit against timeliness and the content. And in the security rule piece, we audit against for risk analysis and risk management. So again, that was for covered entities. For business associates, we audited against notification by a business associate to covered entities under the breach notification rule, and again, risk analysis and risk management under the security rule. So as I said, that's where we are with our audit program, and we're excited to continue with phase two.
Great. I'm sure everyone on the call looks forward to seeing the report that comes out of this process. Are you able to estimate a timeline for when we might see a concluding report?
You know, that's a great question. Certainly, I think we're hoping to pull data and start to try and figure out how we want to characterize a final report this year, but I really can't say much more than that at this time. You know, it really depends a lot on, you know, what data we can get out of our IT system, which is sometimes a challenge. So, you know, so certainly we are looking very closely at these, as we've discussed, at these audits and our findings, not only for compliance issues, but also best practices. And we hope that we can produce a report that's helpful to the public, but also to help us determine what additional guidance we may need to draft in the future as well. So there are a couple of different goals of reporting out of this program, so we're not quite sure what that report will look like yet.
Mm-hmm. I have to say, from my perspective and the perspective of clients I work with, the guidance documents that you've released have been helpful. I imagine that'll continue, as you said, based on the audit procedures as well as other considerations. I guess more generally, I'd like to ask, and then I'd like to bring in others to the conversation, do you see a continuation of the same level of effort in the agency given the change in administration, or is it too soon to tell?
Well, I think certainly on some level it is too soon to tell because we, as you know, do not have a political appointee yet in the Office for Civil Rights. So our director is a political appointee. We have an acting director now who has been with our agency for many years and has acted during 3 different transitions. So, you know, so she's very capable, and the agency is in very capable hands right now. That said, we never know what the incoming political appointees' goals will be and what their approach to our enforcement will be. So we'll have to wait for that. That said, we have no indications from the Secretary, and we've met him, you know, and spent a little bit of time with him and with his staff, and we don't have any current indications that our approach will change anytime soon, and we're looking forward to moving forward with business as usual.
Thank you. Pulling the lens back a little bit and trying to take a broader perspective on cybersecurity, I mean, for the healthcare community, regulated community, HIPAA compliance is always top of mind from the data security perspective. But Lee, let me bring you into the conversation with the two-part question. In addition to HIPAA, what are the other standards out there and other concerns that should be top of mind for folks? I mean, I often describe HIPAA as a floor, not a ceiling, and I guess I'm interested to hear what you have to say about other elements that should be considered as folks sort of pick their way through the forest of acronyms. And the second part of that is really some of those acronyms are really tools you can use to assess and test preparedness of an organization. And so which of those tools are things that should be top of mind as well? So sort of both the regulatory regimes and the tools that can help with compliance.
I think, David, great question. I think a couple of things that are going on in that we're incorporating into our accreditation models as well. I think one, in relation to some of the regulatory side of it, you have not only the HIPAA components, but also there, in many cases, we've got a number of states that have even more stringent privacy and security provisions than even HIPAA. Right. So in many cases, what we're trying to do is to incorporate some of those provisions as well and try to raise the bar in relation to our accreditation model. And I think that individuals and organizations need to be doing that as well and understanding what some of those regulatory provisions are that may be even more stringent. So there's that. I think the other, beyond just the HIPAA side of this, is the whole cybersecurity, and you were talking about that. I think when we start to look at this and look at the number of breaches that we've had, and you you kind of alluded to that in your opening remarks. We went from 12.7 million individual records being breached in 2014. We had 111 million in 2015, and 16.5 million last year. It just shows that we've increased the number of attacks by like 300% just on the HIPAA side. If you look at cybersecurity and the cybersecurity space, we've had about a 63% year-over-year increase in cyber attacks. And you talked about whether or not they're attacks, ransomware, they're medical device hacking. All of this is occurring. And you also talked about the human factor. And that's also a big one that's out there. So last year we had 93 major cyber attacks that also occurred. So the other aspect of this on the cybersecurity side of it is for organizations to be aware of, like the National Institute for Standards and Technology, the NIST publications on cybersecurity, that organizations should be reviewing and incorporating into their overall risk management strategies. They're really their readiness strategies. I think the other aspect of this is that it's not just a matter of whether or not organizations are going to be attacked or have a potential breach today. The answer is, when is that going to happen, and how is an organization going to have the type of readiness situations and planning in place to be able to mitigate the amount of impact to that organization from the standpoint of revenue impact, credibility impact. And so organizations really need to take all of this very seriously. And so the NIST publication is good. Our accreditation, we incorporate both cybersecurity as well as ransomware as well as the whole HIPAA aspect that we're looking at. And this goes back to your point on business associates. And really organizations, and I think Ileana was talking about this, the OCR audits have looked at now both business associates as well as covered entities are really equivalent as far as what they need to have. And I think in many cases we're seeing a lot of covered entities as well requiring business associates to have some level of third-party certification or review or accreditation in place in an effort to mitigate some of that risk. So I think that some and all of this as far as what organizations need to have in place as far as a third-party review for vulnerability testing, their intrusion detection, all of that is extremely important as organizations look at their risk mitigation strategies today, third-party review, and trying to put together their overall planning and their readiness to be able to address when in fact they're going to either have a breach or an incident or a cyber attack to be able to quickly be able to respond to it.
Mac, Bridget, and also Lee, I'd like to ask you to sort of follow up on this and consider for us out loud how these sorts of considerations are relevant or not relevant or relevant in different ways to organizations of different sizes and types. We perpetually are saying or hearing that HIPAA is a flexible standard. So what does that mean in the real world? What are the changes? What are the differences that we need to see in application of these standards to individual organizations? Mac, why don't we start with you?
Sure. So to start with your last question first, I mean, what does it mean when we say the HIPAA security rule is flexible? It means basically that the rule is flexible enough that it allows organizations to identify the controls that are relevant to their environment based on their size, complexity, and the types of things that they're doing with their information and the kinds of operations that they're involved in with their systems. Unfortunately, though, that sometimes creates a problem for some folks because they don't really understand what that translates to, or they don't know how to really figure out, which controls actually should I be applying. Which is one of the reasons why myself and a lot of other folks have been very much advocates of actually recognizing an industry recognized standard for security as being the baseline, if you will, for what you ought to build your program around. And of course, I know that and Ileana can correct me, but I know that HHS and OCR talks about the NIST cybersecurity framework and the NIST frameworks quite often in a lot of their guidance and in their reviews, and quite frankly that it is the most prevalently used framework at the moment throughout healthcare, and as well as other avenues. And this morning I actually even had a conversation with the CEO of the Baldrige organization, who are very active in wanting to make the NIST cybersecurity framework the guiding framework for healthcare organizations in terms of defining what excellence in IT management means. And I fully support that. I think the problem that I have and the challenge I think that the industry has is that we tend to get focused on compliance, and when we talk about the HIPAA security rule, we're actually talking about a compliance mandate, when security is not really a compliance issue. Security is an operational issue, and we need to understand that protecting today's technical environments and data and operations goes well beyond what the HIPAA security rule ever imagined for us. And we need to have something more robust than just focusing on that simple rule and its guidance in terms of protecting 21st century IT systems and operations. It's just that simple. And the other thing is, I think we need to stop focusing on what I call the symptoms and start focusing on the real issues, and that is, we talk about ransomware, and there's an extreme amount of attention given to ransomware. Ransomware is just one form of extortion, of IT type extortion, and extortion takes many different forms. And in fact, the attacks that we're seeing today, because the threat has recognized that now people are actually waking up to the fact that, oh, I do need to have better resiliency in my environment. I do need to have good backups in place so that I can restore my data and not be caught victim in these kinds of events. Are recognizing that they need to take different approaches to how they extort these organizations. So we have attacks now where they're going in and literally making a copy of the data, taking it off-site, and then wiping out the data, wiping out the drives behind them. So we're not just encrypting data in place anymore. We're not just locking up systems. There are all kinds of forms of extortion that are out there. But that's just one type of attack that we're seeing in healthcare today, and we're seeing many different types. And at the same time, we're seeing many different types of more sophisticated hacking activity going on. We're still seeing what I call an unabated level of activity with internal users still doing things that they shouldn't be doing with data and information. And the types of mistakes that we're still making with respect to not managing our environments properly, not doing the basics of keeping them up to date and making them susceptible to malware and that sort of thing. And we just haven't, in my opinion, we just haven't gotten serious yet about the business of securing our environment. I mean, just this morning I was asked to review the OIG report that just came out with respect to HHS's annual assessment. And in that annual assessment, even though it said that HHS was clearly implementing tools and technology to continuously monitor their environment, there were still almost a dozen areas of weakness in their program, which all came back to process. It all came back to discipline and how we manage our environment. And we can buy all the technology in the world. And if we had the people, we could throw all the people at it that you have. But if we don't start doing the basics better in terms of how we architect environments, how we patch systems and configure systems, how we manage change control, who we allow to connect to our network, and how we allow people to connect, etc. If we don't address those fundamental processes that are critical to a good security environment, all the technology in the world is not going to get us there.
Right.
Nor is a rule.
Let me bring Bridget into the conversation here. So I think we have sort of a human motivation question here, and I guess part of the question is this just a question of can we throw more money and resources at it? Max seems to be saying no, that's not enough. From a government perspective, is the answer to throw more fines and sanctions at it? I don't know if that would move the needle on compliance. So Bridget, I'm wondering if you could speak to thoughts you may have about how do we get people to actually take this stuff seriously.
That's a good point. I echo some of the comments that Mac made in terms of the flexibility. The HIPAA provides the flexibility to healthcare organizations to implement technology that they see fit. It's not mandating specific technologies, but the human factor, I think, is a key piece of it. It really comes down to making sure that you have the servers updated, all of the latest patches, making sure that there's a clear understanding, specifically if you think of mobile workers, physicians. A lot of them are using their own devices when communicating, and do they have any standards in place in terms of whether they can be communicating using the secured Wi-Fi network versus when they're at Starbucks on a non-secured network, and are they sending patient health information over an SMS text, over an email, or are they using a secured line to communicate? So I think there's a lot of opportunity for just training, in order to address some of that human element.
So I'd like to focus a little bit, Bridget, on that question of physicians and phones. I mean, is it just a question of training? I mean, there's such a overload in that department. There's so many regulations, so many trainings that physicians have to go through, so much compliance, and for some, I imagine it's a bit of a minor act of rebellion to say, well, I'm going to use these tools on my smartphone. I'm going to do what I need to do to help my patients. The system can go take a hike. Is that a problem that I'm over imagining? Is that something that you see as being on the rise, on the wane? Are there best practices for BYOD, bring your own device policies that folks should be looking at?
Absolutely. I think what is on the rise is mobile workers leveraging technology to do their job. So physicians leveraging their own smartphones, they bring their own device, BYOD, in the workplace for clinical applications. I know we see that in the healthcare organizations that we're working with. Another thing that's on the rise is organizations are implementing mobile strategies. And a mobile strategy is more than just implementing a mobile device management software to manage any of the healthcare applications on that device, load, unload those applications. It really includes things like addressing your Wi-Fi network, making sure that you've got a solid Wi-Fi network, making sure that it's secured, that it's a trusted network, making sure that in addition to the Wi-Fi network, they understand who needs to be communicating and what type of devices do they need. Maybe it's all right for the physicians to use their own smartphone devices, but maybe not everybody in the hospital needs one. So there might be options for other alternatives like secured pagers or Wi-Fi phones. And in addition to that, making sure that they're also assessing their own networks, their Windows servers or SQL servers, making sure that they're looking at their own HR policies, what they have in terms of existing policies that may be impacting the ability to roll out and leverage some of these smartphone technologies, IT security policies, the list goes on and on.
That leads me to another question. I'd like to bring everyone into this discussion, starting with Ileana. The limitations on tools and technologies that are imposed because of security concerns, as Bridget is discussing, come at a cost. And one cost that I'd like to focus on is ease of patient access, right? So from Ileana's perspective, we have both a security concern and a patient access right that needs to be protected. Where do we see the balance point? How can we balance those two interests? Where do we come out in a way that both protects security and honors patients' rights?
Thanks, David. It's an interesting question, but I think it's a question that, for example, the financial industry has already addressed. So this is no longer, an issue in terms of, when you want information from your bank. You go to a secure website and you can get as many transactions back as you want on your bank accounts. So I think it is still an issue for covered entities that we work with in providing that information to patients. I don't think it should be, and I think many of them do a very good job of it from all different levels, from providers' offices to health systems to lab companies. There are companies out there that are doing a good job of providing electronic access to individuals through secure patient portals, for example. Now, that's not required by the rules, certainly, and so working with patients on the best way to get that information to them is always something the entity can do, but there are solutions out there that are working for all different types of regulated entities within this space. So I think it's a very important right, and it is a right that is going to become even more important as we move forward with, for example, the All of Us campaign, and that is trying as a federal government to encourage individuals to take their information and join research studies, for example, so that we can do population studies to really improve health and health outcomes for the entire nation. So not only is it an issue for individual patients, but it's also an issue for us as a nation that this information and getting individuals to not only ask for their information but to use it after they get it is so important. And I think, as I said, other industries are already doing a very good job of this. We can look to other industries, and there are current players in our industry that are also doing a very good job of it.
Mm-hmm. Lee, Mac, thoughts on the tension there? What's the right point of balance, if there is such a thing, between security and patient access?
You know what, David? The one thing I would say is that I think Ileana made some good points. But and as we're starting to look at this, we're looking at adding health information exchanges, ACOs, all the analytics, macro MIPS. This is really all about big data today. And as more and more organizations are taking and trying to consolidate and integrate big data to create the right types of reporting, we look at population health stats, etc. It really comes down to creating that right balance, and patients and systems need to have the right balance for patients to opt in and opt out and patients need to be aware that they have that opportunity to in fact opt out if they don't want to have their information exchanged about and shared amongst a number of entities. But this is the way it's happening, and it's happening extremely fast, and the data exchange side of this is occurring rapidly. So patients, and I think as organizations are building systems, need to assure in the balance and how they're building and developing these systems to assure that patients have the right and that they are made aware that they've got the right to opt in or opt out of these various exchanges. That's the type of balance I think we need to be getting to, and assuring that the appropriate controls are in place on how their data is going to be exchanged and that it's being protected and secured in the appropriate way.
Mm-hmm. Does the hardware matter? Does the user matter? We got into this part of the discussion through a discussion of physician smartphones, but now we're sort of segueing into patient smartphones, presumably for the most part. Mac, thoughts on that or other parts of this question?
So it's an interesting question because you as both Lee and Ileana articulated, you get caught up in the argument of not wanting to slow down the exchange of information for the benefit of the patient, and I think that's something we all have to always keep in mind. But Ileana made an absolutely great observation in that there are other industries, the financial sector being one in particular, that has already solved a lot of these problems with respect to how to get information in the hands of the user on almost any device out there, but and do so in a secure manner. I mean, what's interesting, I was talking to a group at a hospital yesterday, and they were debating whether or not they could implement two-factor authentication because they felt that might be difficult for the workforce. And I stopped them and I said, how many people in this room do online banking? And of course, every single one of them did. And I said, how many of you have an app on your phone for online banking? And of course, every single one of them did. And I said, how many of you have online banking where you don't have two-factor authentication? And of course, none of them did. And I said, how is it that we can go through our daily lives and use two-factor authentication, which absolutely makes it much more difficult for the threat to take advantage of us online, and use it for banking and other purposes, but we can't use a second factor when we're logging into the EHR? I said, I just want one of you to explain to me why these users, these workforce members, who are all using it every day with their bank account, can't do it with their clinical systems.
Right. Healthcare is different, right?
Yeah. The bottom line is, regardless of whether you opt in, opt out. I've talked to a lot of folks that they don't really understand what that means half the time. Even when they do understand what it means, at the end of the day, what they really expect is that anybody that they share their information with is going to be responsible in how they handle it. And so it absolutely, the technology, the platform, et cetera, absolutely does matter. We can achieve what we need in terms of balance and the ability to share data across many different avenues and still do it in a smart way. We just have to make a commitment to do that.
Mm-hmm. So we've been talking sort of generically about sharing of information between institutions, individual providers, and patients, and the risks and the opportunities to mitigate risks that are there. But sort of going beyond that sort of communication through smartphones or other applications, we have this growing Internet of Things, the interconnectedness of everything. Devices, medical devices, whether they're not quote-unquote medical devices, but scales, even blood pressure cuffs that people are using in the home that are connecting to their providers one way or another, or something much at the other end of the scale, like an implantable cardiac defibrillator or pacemaker, something like that. What are we doing? What should we be doing to address the threats and risks on that front? On that front, what's the kind of thing that keeps you up at night or keeps your customers up at night? What should we be scared about? What do we have well in hand, and what should we be scared about, folks?
Well, I think the thing that worries me the most, and the thing that I hear most often from our customers now, is now that we've seen these Internet of Things types attacks, like the Mirai and the leak attacks that we saw at the end of last year, that commandeered hundreds of thousands of devices across the Internet and then used them to attack the dying servers and knock out those DNS servers that were so critical for communications. That a lot of them are sitting there looking at their medical device community now and saying, we know these devices are not secure. And if these other types of attacks continue, if they are attacking devices that are just connected wirelessly to the internet, how close are we to an inadvertent issue with something like this? So in other words, even if somebody isn't attacking patients directly or isn't attacking medical devices directly, but they're just out there running one of these Internet of Things type attacks, and they accidentally stumble on medical devices and commandeer those and divert them from their intended purpose, and that affects somebody, how close are we getting to the accidental issue? And that's worrying a lot of people now with these new attacks that we're seeing that are so disruptive.
Mm-hmm.
David, as you look at it, and I think Mac brought up some good points. I mean, we're looking at in last year we were about at 6 billion devices, both combination of medical devices, smart TVs, and smart in cars having the technology and all being interconnected through this Internet of Things. The projection is for that to go to over almost close to 21 billion devices connected in 2020. I mean, so it's exponentially increasing. I think the aspect when you're looking at it from a healthcare perspective is just as Mac was talking about. Somebody inadvertently being able to go in and perhaps take control of devices, and whether or not it's an insulin pump, again, it's going to put somebody at significant risk. Mm-hmm. Or an implanted defibrillator, any of those can occur and be affected, as well as the whole aspect. If you look at it from they're saying for cars, anybody can. It's already been proven that hackers can go in and take control of cars, right. And so you start to put all this in perspective, and you start to look at how this is exponentially increasing in volume to again. 21 billion devices by 2020, the risk is going to continue to go up. And so what it means is that organizations have to be looking at this in relation to what types of controls are they putting in place, how are they putting in the security infrastructure to mitigate as much of this risk as possible. But the issue is that the risk continues to go up exponentially. The only other thing I was going to mention, you know, when I was at HIMSS last week, there were a number of different surveys that have gone on between, you know, HIMSS and Chime and other organizations. And the one thing that came out, which goes back to kind of the basics that Ileana and others have talked about, is the fact that so many organizations, providers, other types of smaller organizations, even mid to larger organizations, don't do the basics foundationally. They don't do an annual risk assessment. They don't go through and do the type of training that's necessary and increase overall visibility. And I do think that what it's going to take is it takes more case studies and more what I would call incidents where somebody who's a friend of a provider basically gets hacked or has a fine or whatever that occurs. That's where people start to take it seriously. But even if it's a provider, I talk to many providers today, smaller providers, who say, you know, gee, nobody's going to hack my practice. I'm too small. But that's exactly what cyber attackers are going after, because they can get 2,000 or 3,000 records at a time. You look at what that's worth on the black market, that's what they're going after. So everyone, whether it's a small entity or larger entity, needs to take it seriously. And Internet of Things becomes, you know, just another major factor here that's going to exponentially increase that risk.
So for folks on the smaller end of the size spectrum, Lee and others, we talked earlier about sort of scaling compliance based on size and complexity of an operation. Is there some sort of bare minimum set of things that somebody needs to do where you could say, yeah, I know that, you know, you think I'm telling you you have to do, you know, all this, but, you know, to get in pretty good shape, let's just start here. Is there some bare minimum approach to cybersecurity that we can offer as a prescription to smaller organizations? Or is the answer just no? You got to just do everything you need to do?
Well, one of the things I would tell you, at least from as we do our accreditations, we do accreditations for organizations that are extremely small to very large organizations. Mm-hmm. Organizations can go to our website and take a look at our programs. We scale. What I would tell you the answer to the question, David, is we scale our accreditation and reviews of organizations based on the size of organization. For example, a very small entity that we're accrediting, we're looking for that organization to still have policies, procedures, controls in place. How the level of documentation that they may have is going to be nowhere near what we're looking for an organization that's, say, 75 million in revenue or larger. So it needs to be scaled to what the organization has, the size of the office. So when we're looking as well and reviewing, doing a site review on an organization, it's based upon how big that organization is and what they may have in place. What we're looking, though, is to have a base set of those policies, procedures, and controls. They're doing annual training. They have a risk assessment that they're doing as an organization on an annual basis. But again, the level of detail that they're going to be going through, we're not looking for them to have a dissertation. We're looking for them to have a base level disaster recovery plan and how they're going to actually address this in the event that they have a breach. That's how it has to be scaled, and that's how we look at it, and I think that's how organizations need to do that. You can't apply the same level of documentation that we're looking for from one organization is not necessarily the same level, but the base level types of controls and policies and procedures need to be there based upon what makes sense for the organization.
Sure. Anyone else, feel free to jump in. Just sort of add another dimension to the question, which is some folks say, you know, it's appropriate to take the measure of the size of your compliance program and efforts should be a percentage of your IT budget. Is that an approach that makes sense? That would sort of allow for scaling to size of organization, perhaps. Others, something that makes sense. Is there a benchmark that you think you are willing to recommend? How do you advise people to deal with this conundrum?
Well, the problem with some of those benchmarks is that there are different business models that are out there, number one, and number two, the size of organizations has a tremendous impact on what level of spend is or isn't appropriate to meet the requirements. So what do I mean by that? Well, if you're talking about a smaller organization who perhaps has most of their infrastructure, even their applications, hosted in the cloud or at a service provider. So in other words, they have an EHR as a service as opposed to on-prem, and perhaps isn't even managing most of their applications themselves on site. Just throwing out an average figure in terms of percentage of your budget for security for that organization is going to be very different than an organization that has all of those things organic in-house that they're managing themselves. So it's kind of hard to throw something out like that and say that this is what fits everybody. Generally speaking, when you look at those numbers that people talk about, whether it's the 12 to 15% that you see in the finance sector or what have you, they're really talking about larger organizations that have IT staffs and have they're more of a larger business in the sense that of what they're managing. And when you get to that, when you get to larger organizations, there is absolutely some truth to it, that there's a correlation between the amount of spend on security and the level of maturity that you're likely to see in a program at an organization. So, when I hear those numbers, sometimes I just go, when we start talking about small organizations versus large organizations, I feel it's not really an appropriate measuring stick. But if you're talking about just larger organizations like hospitals and IDNs and large health systems, the complexity of the hospital environment today is no less sophisticated than the complexity in a financial sector organization or a large retail business. So there are some very, very common corollaries between what it takes to protect the business or secure the data in those kinds of environments that are applicable.
Yeah.
David, one thing I would tell you is that I know that HIMSS and Symantec did a study this past year. It was their second annual study on looking at the whole aspect of risk management in organizations. And I agree with what Mac is talking about as far as it really applies to larger organizations. You can't, in most cases, a lot of smaller organizations may be outsourcing a lot of that. But what they came up with as far as a guideline that they were looking at evaluating against was a number between 7 to 10% of IT budget spent on, say, security, cybersecurity.
Right.
That's kind of the guideline I've seen out there that organizations spend. But,
right. So there's a benchmark, but it may or may not be applicable to all.
Absolutely, absolutely.
Great, great. So, I mean, another kind of concern that I think the larger organizations have, and maybe this is present in smaller organizations as well, people, tell me if you feel differently, is sort of the question of risk that's associated with the match line between different systems. So a hospital that's grown its IT organically over time has a million different systems that need to be integrated with each other. And each of those integrations is perhaps another point of risk. Is that is that an issue that's sort of unique to large hospitals, AMCs, IDNs, or do we see that in other settings as well?
I think we see it in all sorts of settings today. And I mean, healthcare today is very much, I don't know the term to use, but we have mergers and acquisitions going on across the board in healthcare today, both
right.
large organizations and even small organizations that are merging together and creating larger organizations. And anytime two organizations come together or one organization acquires another, there are always things that have to be considered in that process around privacy and security, and should be. And in fact, oftentimes what our experience has been is that when larger systems are acquiring smaller systems, oftentimes those smaller systems, not all the time, but a lot of times, those smaller systems are already distressed businesses. And any time that you see an organization that is financially distressed, typically those things that are not directly related to business expense become optional, which means they stop spending money on things like annual risk assessments or security costs or things of that nature. And so a lot of times these organizations that are acquired are not at the same level with respect to security as the organization that's acquiring them. We also see hospitals now, large health systems that are beginning to spin off hospitals. The community health situation is one in particular. You see them
Sure.
almost appearing to have a fire sale of hospitals,
right.
and we know that they're in having issues. So the question is, what condition are those organizations in that you're acquiring? And you need to figure that out. You need to figure it out as part of that M&A process, so that you know what you need to address once you begin to connect them to your back end.
Right, absolutely.
David, I think we've come a long way in relation to interoperability, and we've seen a lot of progress there in that whole aspect of trying to reduce the number of interfaces. But I still go into hospitals that you were talking about. I still see different setups in which you have over 150 different interfaces between different systems and devices, and those are all risk points, as you were talking about. But I think, as Mac was talking about, it's happening all over, and I do agree with, as we've seen a number of organizations, we have a number of our organizations go through and they're getting another organization that they're acquiring, and in many cases, David, Mac is right. A lot of these organizations they're trying to maintain and being able to at least have a good revenue as an organization and maintain viability, only to find out that things like their risk assessments, et cetera, a lot of their security aspect they've completely defunded them. So that's where a lot of organizations need to be looking at really whether or not these organizations that they're acquiring have the appropriate infrastructure in place when they're looking to acquire them, or they got to be willing to put in the dollars and the investment that's going to be necessary to bring them up to the appropriate levels and benchmarks that need to be there.
Mm-hmm. So somebody tell me some good news. Are there any things out there that we think people are generally doing pretty well? I'm thinking just sort of by analogy from the meaningful use measures in the EHR context. There are a bunch of measures where basically virtually everybody maxed out. We've checked this box. We're doing this thing 90-95% of the time. We're not going to get much better than that. Let's move on and measure something else. Let's worry about something else. Is there any domain or area within the realm of cybersecurity where the industry is doing a pretty good job? Dead silence.
I think a couple of things. I'll at least weigh in here. So
Okay.
a couple of things that we're doing, I think, pretty well. One is, and starting to. One is, for example, NHISAC, which is a federal organization that's monitoring a lot of cyber attacks that are occurring across the industry. They've created an alert database that's out there that's creating at least a database of various types of situations that organizations need to be aware of and what they need to do. High Trust is also doing something like that, and we've partnered with High Trust on creating a combined accreditation and certification model as well. They've created an alert database as well. I think there's a lot of things that are going on, David. I could tell you that as far as resources that people can avail themselves of today that were probably not there even a couple of years ago. So there are great resources that people should use. There are some great use cases. There's some great tools. The NIST documentation that we talked about are
Right.
all that people should make themselves aware of.
Great, great. Yeah, all good things. Other thoughts? Others on the panel?
Well, I think there's some bright spots out there, and we have some health systems out there that one of the things that the AHIS group now that the CISOs have and I'm assuming everybody understands who AHIS is. It's the Association of Executives in Healthcare Information Security under the CHIME organization. There's been a lot of progress in the last year. That group, by the way, grew from 0 to almost 500 members in less than a year and a half, which is pretty amazing. So there are lots of folks out there now that are involved in information security and healthcare that are beginning to communicate with each other through these different venues that have been talked about already. And these folks they're very enthusiastic about what they're doing. They're very enthusiastic about building better platforms for the entire community. And I think that there are some positive things going on out there, and we're going to probably see the benefit from that in the next 3 to 5 years. But it's like anything else; it'll take a while to take hold. But the good news is I think we're making progress, and that's what's important.
Yeah, I would just echo what Mac is saying. I mean, if you look back to some of the comments that I saw in the post-HIMSS publications, security was one of the #1 topics that came out of HIMSS. And as we look ahead, there's value in all of these IoT solutions that people are putting in place, the interoperability between these. I think the next wave that we're going to see is increased security on top of these IoT solutions and the interoperability between these solutions.
Eliana, any thoughts from your perspective about what you see people doing right?
Well, David, I'm the head for enforcement, so I don't actually see that much of the good things. As I said, I'm really looking forward to the audit reports and the outcome of our audit program, so I can see some of those best practices. I know they're out there. Unfortunately, I usually get to come in when things have gone very, very wrong for one reason or another. So I will say that, like much of the panel has already said, the awareness in our industry, it has increased. And I think that is a really positive step. I think the questions that I get now versus the questions that I got even 2 or 3 years ago are much more sophisticated and are really showing that people are starting to wrestle with these tough issues. And I think that at least is progress from my perspective.
Right. I would have to say I've mentioned before the guidance documents that the office has been putting out, and I think that surprisingly to me or maybe to us on the call, but many people see some of those documents as new rules where there are really more explications of rules that have been on the books for a while, and some folks are glad to see them. And they feel that it offers a measure of predictability to their operations.
Yeah, that's great to hear. we have been very focused on additional guidance on many different topics, including with the privacy rule. But from my perspective, obviously, our ransomware guidance, our cloud guidance, these are not new, as you said, new ways of approaching the same issues. They're just articulations of how we do approach those issues. We are preparing more guidance to come, hopefully very shortly as well, on how we do enforcement and how we calculate CMPs and settlement agreements. Again, all of that is in the enforcement rule, but we want to help with the transparency and help people understand what that means from a practical perspective. So always glad to get suggestions for additional guidance. We're working on revising guidance, working with NIST on guidance. So, so as I said, we are always glad to hear that people find it helpful, and we'll continue to do our best to get those guidance documents out.
Excellent.
David, I think the other thing that Ileana, I got to tell you as well, I think as we're talking about increased awareness, I think the OCR website, where a number of these different breaches have occurred, and the information that's being shared and the transparency through that has also increased awareness. And I think more and more people, as far as the audit process, are aware of what OCR is doing. And I think they're going to that website. They're looking at various scenarios that have been identified there, and I think that helps as well organizations take things a lot more seriously as well.
All good to hear.
Great.
Hello?
Hello.
Hi, it's Carol. I'm back on.
Great. Carol, I don't know if we've gotten any questions from the audience or other points that are worth bringing into the discussion here.
Yeah, we have. We've gotten a number of them, and I thought I would just take myself off mute so we could spend the next 15 minutes addressing some of these and getting feedback from the panelists.
Great.
One sort of interesting question, and there we go. Bridget, you actually talked about the people factor as part of your conversation, and this person, when you were talking, chimed in and said there was an article recently that I read that young people have a reduced sense of privacy, sensitivity to privacy. Do you find, or any of the panelists, do you find there's an age-related problem here when it comes to those security attacks that are, put the thumb drive in, downloaded a file, did something on Facebook while at work, generationally, or older people just more security aware than younger people?
Well, I'll take a first stab at this. I think just generally speaking, our younger generations they grew up with social media being the norm. They grew up exposing things that I think some of the older generations, including myself, weren't really used to sharing so widely and so publicly. So I think in general, some of the younger generations are more comfortable sharing more information and therefore have a lower threshold to security and privacy. I'm interested in what others might have to say on that.
I have sort of the opposite perspective personally. I've seen older folks, myself included, sort of not being that concerned about privacy settings in social media contexts, for example, where my kids and their generation are intensely interested in privacy settings and who sees what and who has access to what. Some of us were talking earlier about webcams. My teenage daughter, with no prompting from me, put a piece of duct tape over her webcam on her laptop. Because, yeah, no, that's not a good thing. I think the younger folks have a pretty high degree of sensitivity to privacy concerns.
So it's really interesting because I sat in on a presentation not too long ago by a social scientist, I guess is what her title was, and basically she's one of these people that studies the generational norms, and I think what we're seeing is we have different generations are approaching this in different ways. And I agree with that. Some of our older folks are not paying attention to those settings and whatnot in social media because, quite frankly, they're just really not that good at using those things. And in many cases, they don't understand what all those settings are and how to use them. And I say that because I have an 85-year-old mother who lives with us, and and we spend a lot of time helping her understand how to use her smartphone and social media and whatnot to communicate with her family and her grandchildren and great-grandchildren, etc. By the same token, if you look at the people in my generation that are now in their 60s, we tend to be very private. In many cases, a lot of our generation isn't even on social media. In some cases, some of us don't even use it that much because we don't trust it. But when you go down to the generations that are in their 30s and 40s, these are the folks who really started this whole revolution around social media, and they tend to represent what you talked about earlier, which is the folks who are not as concerned, or who weren't as concerned with their privacy, and would essentially talk about just about anything in group settings or in social media, and have now been the victims of some of the backlash of some of that, as well as some of the crime that we've seen on the net now with respect to social media. And now we have a new generation, as she described it, of these even younger folks that are in their teens and early 20s who have witnessed this, and who are now being much smarter about utilizing their privacy settings on social media and on who they're communicating with, etc. Because they've become sensitized to the fact that, oh, everything you put out there, it doesn't necessarily end up in a very positive manner, number one. And number two, everybody that you contact or communicate with out there is not necessarily your friend or has your best interest in mind. And I read a report just recently that talked about a new form of extortion where cyber criminals are extorting young people over the net through social media by getting them to post information or pictures or whatnot that puts them in compromising positions, or their families, and then they extort these young people through their family, through the social media. So, I think it's a generational thing. I think to categorize it as all young people are being smart about it is not right. I think all young people are not necessarily doing what we would like for them to do, and unfortunately that puts them at risk. But I think the biggest message from all of this is that we have to absolutely pay attention to what we're doing with social media and how we're using it, and especially how young people around us are using it, and our children, and because it is not a safe place for them to be all the time, and that's unfortunate.
David, one thing I was going to just add to, you were talking about your daughter putting a piece of duct tape over the webcam. About 90 days ago, there was you want to talk about how important it was. 90 days ago, the Today Show did an interview with Mark Zuckerberg of Facebook. On that interview, Mark Zuckerberg, he had there was a laptop right next to him. He went over, stopped the interview, went over, put a piece of tape over the webcam before he actually continued with the interview, because of the concern that he had and who has more infrastructure than probably Mark Zuckerberg at Facebook, but was concerned as well that they can come in and take control of his laptop and his webcam. So it just to show, I mean, it's that prolific out there, and so whether or not it's young people or whether or not it's the older. And the other thing was, we talked about Internet of Things before, and Mac, you were talking about like your mother and kind of the older generation. the issue is they had an article in the paper about the fact that smart TVs now, if you don't change your settings, there's a lot of data that these manufacturers are able to collect on people. If you don't change your settings to do that, then all this data is being accumulated and sent. But to go in, they actually went on and were telling people what they need to do. Most older people are not going to be able to go through and set up their TV in relation to the types of controls that they have. So it's not easy. That's I think the bottom line here.
Mm-hmm. Yeah.
All right.
Yeah. But it's important.
Yes.
It is important.
Yes. Just going to take a couple more questions before we wrap up. I want to remind everybody who's chatting to me that, yes, I will get a recording of this presentation out to you. And if we don't get to a question, and we've got quite a few that we're not going to get to, please email me and I will parcel them out. To the earlier point about going after the root versus the symptoms, what can the industry do to actually devalue the data being stolen? Can anything be done about that? I mean, Lee mentioned $500 a record. Can anything be done from an industry standpoint so that it's just not as valuable to the hackers out there, the criminals?
I don't see that. I don't see it happening, Carol. I mean, the issue is that if you look at it, and as I've talked about, credit card record is worth about $1 on the black market. The numbers for electronic health record is anywhere from $100 to $500. I'm hearing on the market. The issue is, and the reason it's so expensive and worth so much is what cyber attackers can do with fraud with any of these records. And so that and you look at the 1.3 trillion that we're spending on healthcare, the numbers are about 8 to 10% of that can be attributed to fraud. It's a very large number. And so the issue is that unless that's going to be addressed in some way, and we reduce what that's actually worth, and we reduce the amount of fraud, the answer is it's just a very lucrative way for cyber attackers to make a lot of money. And so whether or not it's a smaller provider thinking that their practice is not vulnerable to a larger entity, the answer is it's all vulnerable, because they're going after a couple thousand records to a couple hundred records, and there's a lot of money to be had with that.
Hey, Carol, this is Ileana. I just wanted to, sorry, David. I just wanted to weigh in. I absolutely agree with what Lee has said, but I do want to emphasize that that is one of the reasons that the patient right to access under the HIPAA privacy rule is so important. Because if we can educate consumers of healthcare to check their health records the way we educate consumers of finances to check their credit records, then we can combat this. We can, if people are more aggressive about getting access to their records, knowing who has seen their records, knowing what's in their records, and identifying for covered entities where the errors are, such that the entities can remedy those mistakes, then perhaps there will be less incentive to go after healthcare records. So, so I think a lot of what we are trying to do at OCR is to educate our public campaigns that we're working on right now and that we've worked on in the past to individuals are about the power of the information in those records. And our last campaign was called Information is Powerful Medicine, because it's really about educating consumers on what they can do with their own information and monitoring their own information. And covered entities, rather than putting up barriers, as some do, to patient access to information, should be leveraging those relationships to educate their consumers about how to use this information in ways that are also beneficial to those entities.
Couldn't agree more. Some of the barriers that some folks put up in that context in the past year included situations where there was medical identity theft, and a provider, when asked for full access to a patient's electronic health record by the patient was told, well, there's someone else's health data in your record, so no, we can't give you your EHR.
Right, and David, that's obviously something that OCR has said is not okay.
Yes, no, I know. That's the end of the story, is that you've spoken out about that, of course. But yeah, the idea that you can be the target of medical fraud to that degree, where somebody's gotten a hip replacement or whatever on your insurer's nickel, and then you're not allowed to get a copy of your record because someone else's data is in it, is what was an absurdity.
Right, right.
Yeah. So I mean, to the question that Carol raised, even where we have encryption of data or tokenization of data, and sort of the most secure programs in place, we still have these human factors where through phishing attacks or otherwise, the encrypted, tokenized data can still be accessed by the bad guys. So to me, the weakest link continues to be the human factors and the need for training, testing, sending out at random fake phishing emails to folks within an organization to see if they've assimilated the training sufficiently.
Yeah. With that, guys, we've run over our time, so thank you so much for staying on with us. I'm going to wrap it up right now. And again, there are quite a few questions out here that we'll start to get to remotely, offline. We'll get a copy of the recording out to all of you. And I just want to thank all of you, Bridget, Ileana, Lee, Mac, and of course, David. Thank you so much for your time today. This has been a great panel discussion, and we appreciate it.
Thank you all.
Thank you, Carol.
Bye.